Let me just say, I do think there's a serious effort starting tomorrow in our Help Committee to craft legislation that will correct some of the well-recognized problems that need to be corrected in our healthcare system. This is not a throwing out the old system and replacing it with an entirely new system. This is correcting problems that there's general consensus need to be corrected. We had a good hearing Thursday afternoon, which Senator Dodd chaired, and we had a broad cross-section of witnesses there representing a lot of healthcare providers, insurance providers, experts of various kinds. And the thing that struck me about their testimony was how much we agreed upon, how much they agreed upon. 4 things in particular that they said they agreed upon is reforms of the insurance market. We should not have people selling insurance policies on the basis of who can they find who's not going to need insurance and sell them a policy. We've got to have a system where if you're going to sell an insurance policy, a healthcare insurance policy in the future, you've got to make it generally available to the public, and you can't have a lot of gotchas in the policy. It's got to cover the things that people need insurance to cover. We need to have some kind of a requirement on individuals in this country to obtain coverage one way or another, either through a public program or some kind of private coverage. But I think there's general agreement on that. We're not going to deal with the 45 or 50 million people who don't have coverage unless we have some kind of requirement. Now, having that means we've got to subsidize. We've got to provide some help to those people so that many of those people at least, so that they can afford coverage. And I think there's general agreement on that as well. And then we need to be sure that there is assistance to small employers. Mark was referred to here by Senator Mikulski. I think he's an example of an employer who is providing coverage. There are a lot of employers in my state who are also providing coverage, but many who are not. They can't afford it. And we need to have government-supported credits that will help those folks to provide some coverage and assist with that coverage. So there's a lot we can agree upon. I think that building on those common agreements, we can put together legislation that will be very good for the country. And I hope that we have serious buy-in by all of our colleagues in that effort. And that's the purpose of the markup that starts tomorrow.